Patellar tracking and knee pain is an extremely common condition that clients will present with in clinical practice, and it responds exceptionally well to taping. So one of the main causes is that the patella can actually move out of position. It can start to track off to the side. Usually it will move laterally, and this can be because vastus lateralis is dominating compared to the fibers of vastus medialis. It's pulling the patella a little bit this way. Or a more common cause is a little bit of lateral rotation of the tibia. So if the short head of bicep femoris gets tight, it can rotate the tibia a little bit laterally, and the patella then starts to track off center. So there is a groove in the end of the femur. We'll see this, that the patella should track through. And you can imagine if this attachment site moves laterally, or if vastus lateralis is pulling laterally, the patella will start to track over and it will start to catch here. So we can get destruction of the cartilage on the underside of the patella, or we can get nipping in the surrounding soft tissues, either of which can cause fairly significant pain in this area. So let's take a look at our taping application. This one is a little bit unusual because what's shown in the video is the full application where you use 3 pieces of tape. But I find that it's best to start with 1 piece of tape, check client response, have them do an activity, maybe going up and down stairs, or a body weight squat or a single leg squat to see do symptoms present. And if necessary, then add a layer of tape. So our first piece of tape, we're going to split the tape in the center, and we're going to just cover the lateral half of the patella, staying just slightly shy of the midway point. We're going to apply 25% stretch to this piece of tape, and then have the client bend their knee. And as they bend the knee, the tape will start to curl around. And this will add tension up to 50% stretch on the tape. So we're going to curl around with no tension again on the ends of the tape. So if we test that and the client still presents with symptoms, then we can move to our second piece of tape. So our second piece of tape then is going to cover the medial side of the patella. Again, splitting the backing paper in the center, covering the medial portion of the patella this time. And as the client bends their knee, we continue with our taping, overlapping the previous taping, bending across, and this will help keep the patella a little bit more centered. Now, if we test and the client still has mild symptoms, because usually you'll get significant reduction but not complete clearing of symptoms with these first 2 pieces of tape, so you may want to move to the third piece of tape, which we're going to apply to the patellar ligament, which is the continuity of the quad tendon. Now again, we're going to start in the center, ask the client to bend the knee, and as they do, the tape kind of wraps up, it bends around the sides. And usually this last piece of tape will have the client feeling that the knee is extremely well supported. They don't tend to still experience the same degree of symptoms, that they'll notice a significant reduction and sometimes a complete clearing of symptoms once we do this last piece of tape. So we'll see this now a little bit more clearly once we colour all of these in. And we see our medial taping is helping to stabilize the patella on the inside. Our lateral taping is really correcting most of the tracking problems where we said the patella has a tendency to track outwards. And then this last section is kind of unloading the patellar ligament, and it takes some tension off the quads and allows them to relax, which further reduces the pull on the patella. And again, you can watch the video and you'll see the application of these 3, but I strongly recommend applying 1 piece and retesting. If symptoms still present, then apply a second piece. And if there are still mild symptoms or the client says they still don't feel 100% confident with the knee, apply this third piece of tape. Up to 3 pieces of tape can be used to assist with patellar tracking. 1 is applied to the lateral portion of the patella, 1 to the medial portion, and a third piece can be applied to the patellar ligament. The ligaments to the side of the knee joint are intended to provide stability to the knee so that it doesn't bend sideways. However, they can become injured either through twisting of the knee or through lateral forces. So we have 2 main ligaments that we're going to look at taping here. We're going to just fade out the other structures so that we can see the lateral collateral ligament here and the medial collateral ligament on the inside of the knee. So these are the 2 structures we're going to be taping for in this video. So when we apply the skin over this, we'll see when you're palpating, it's a good idea to actually get used to feeling the joint margin here, that as you palpate through, a lot of these other ligaments in the area, like these patellar retinaculum and so on, they're quite thin by comparison. So we'll actually feel the joint margin through these guys, and we'll be able to palpate and feel the difference then when we get to palpate the collateral ligaments, they tend to be a lot tougher. So you can feel the space here along the line of the joint, or on the other side, if we go from the area of the patella. A lot of these other structures are relatively soft, so we'll be able to feel the joint margin, and then we'll feel the tougher structure of the ligament here. So in our video, it shows taping just for camera purposes on one leg for the lateral and the other leg for the medial collateral, but in this we're actually going to just tape both of them together on the same leg. So let's bring in the skin, and when we then apply our taping, we're going to use a blue piece of tape here, or a blue marker. So we're going to, with this it's quite unusual, when we go to tape ligaments, rather than starting proximal and taping distally, or starting distally and taping proximally, we're actually going to tear the tape in the center, because this is a support, so we want the support to be directly over the structure we're trying to apply the tape to. So let's just rotate our model. We're going to zoom in a little bit. As I said, you can stop the recording at any stage and you can manipulate the model here yourself. So when we go to apply our taping, we're going to start in the very center here. We're going to break the tape and peel some of the paper back. We're then going to apply quite a bit of stretch. So this is like 50 to 80%. It's almost maximal, because we want to take a lot of the elasticity out of the tape so that we start to engage the cotton for support, which is a slightly more rigid structure. We don't go to 100% because we do still want some mobility, we want some movement. So 50 to 80%, usually about the 50-60% is going to be sufficient. We're going to tape out from this point. So this has a strong degree of tension on this portion of the tape here. And then because there's a lot of tension in these sections, we need to allow a reasonable length of tape for that pressure to dissipate. So we always say the anchors have no tension on them because we want the pressure to not pull on the skin and damage the skin. But when we have a strong stretch on the tape, we actually need a longer section. The recommendation is almost 30% of the length of the tape is given over to the anchor. So we have quite long sections that don't have any tension to allow this strong tension in the center to dissipate. So these long anchors are quite important when we're using a lot of stretch on the tape. So that's our application for the lateral collateral. We'll see this filled in properly in a moment, and we'll also have a video illustrating this. So medial collateral then is going to be pretty similar. The application is actually going to be the same. So we're going to start by splitting the paper of the tape in the center and applying the tape away from the very center with a strong degree of stretch. Again, long anchors with no stretch whatsoever to dissipate the strong degree of tension that we're putting in on this. So let's bring in a screen and we'll see how this is then going to look when we have our finished taping. And we'll also see our video here as well. So we see our lateral collateral ligament support here and medial collateral on the inside. As I said, you can play the video then and see how the application is done. To support the lateral and medial collateral ligaments, tape is applied with 50 to 80% stretch, starting centrally and allowing up to 30% of the length of the tape at each end to dissipate this strong stretch. To support the lateral and medial collateral ligaments, tape is applied with 50 to 80% stretch, starting centrally and allowing up to 30% of the length of the tape at each end to dissipate this strong stretch. Pes Anserinus is the name given to the attachment of three different muscles here at the inside of the knee. We see them here traveling around the inside area. And these three muscles are quite different in their roles. We have sartorius to the front, we have gracilis, and then we have semitendinosus to the back. So we primarily have a hip flexor, an adductor, and a hip extender. And if we're sedentary too much, these tendons can become adhered here, and they can cause medial knee pain because this adhesion will pull on their attachment site and we'll get what's known as simple tendon pain. That there isn't any injury, there isn't any scar tissue, but there is pain simply because of the degree of adhesion and these structures are pulling on each other. So we could tape this in a couple of different ways. One option would be to use separate strips of tape that we could use a couple of different eye strips. We could anchor them here. We could have one strip covering sartorius, one strip covering the gracilis, and one covering semitendinosus. What's shown here in the video is a milder taping where we're going to just use one strip that is cut into multiple parts. So we're just going to use a green piece of tape here, same as our video, and we're going to start just down past the attachment. Something that's very useful is the use of the discovery tool. So when we're using the discover tool, we can select that it cuts just through the skin, and we can see the area here. So we can see the attachment site, and we're going to start a little bit beyond that because we have our first piece of tape with no tension on it whatsoever. So let's clear our discover tool, and we're going to move to applying our tape. So we're going to anchor a little bit distal from that point. This section, of course, having no tension. We're going to then have quite a degree of stretch on the tape as we come around here, so between 25 and 50%. And once we come past the main group of the tendinous tissue here, we can then split the tape, as we said, into separate individual tails. So we would split this into 3, and we would have one section that's going to be covering sartorius. So we'd have a piece of tape coming up like this, not going all the way up to the attachment, but covering most of the muscle, enough to influence it, both to free up the connective tissue and to affect the proprioceptors that regulate tone in this muscle. And then we're going to have another strip covering gracilis, and we can see the attachment of gracilis up here. So that's where we're heading for. Again, not going all the way up to the attachment site because the taping would be a little bit intrusive, but covering the majority of the muscle. And then our third piece of tape covering semitendinosus, so it's going to head almost for the ischial tuberosity here at the back, but again not going quite up to the attachment. Okay, now let's take a look at one of our slides. This will have a slightly neater version of the taping on it, and we can see how this is being applied. So as we said, anchoring distally. So our anchor is a little bit past the attachment site here. We have 25 to 50% stretch, and the same going all the way up towards the end of the tails, but again allowing a section here with no stretch on the tape at all. We want to dissipate the stretch before we get to the end of the tape so that we don't damage the skin. And as I said, you can see this in the video, or if you wish, an alternate taping would be to use individual eye strips. You could use 3 pieces of tape, one for each of these muscles. But remember, if you were going to use 3 individual pieces of tape, you want to make sure that they finish in slightly different places so that each piece of tape is finishing on skin so that it grips properly.
The taping for Pes Anserinus begins distally at the common attachment site. One of 3 strips are then applied each to sartorius, gracilis and semitendinosus with 15 to 25% stretch. The taping for Pes Anserinus begins distally at the common attachment site. One of 3 strips are then applied each to sartorius, gracilis and semitendinosus with 15 to 25% stretch.